Everything that you see on the outside of your lady parts is actually not your vagina, so that you feel more confident. Vulva, which is all of this. You do not pee out of your vagina. You're too embarrassed to look at your girl parts because whoever said that was something that you should be doing routinely, but who better to teach you about it than me, somebody who refers to themselves as the Vag Doc, your local OBGYN. I love women and I want to make sure that you know everything that you need to know. When we were in health class, maybe we were taught some very basic things like you have a vagina or you have a penis. There's basic pictures. Nobody really went into detail with you. But did you know that everything that you see on the outside of your lady parts is actually not your vagina? Everything on the outside is your vulva. It is totally different anatomy. So what are you missing out on and what have you been left in the lurch understanding? We are going to learn all of these outside bits and a little bit of the inside stuff so that you feel more confident actually knowing what is going on with your body. Because unlike men, all their stuff hangs out. It's easy to point and label. Our stuff, very kind of secretive and hidden, and I want to make sure that you feel empowered to understand these parts so that you can take good care of yourself. This is Doris. I named her after somebody very special in my medical education. When I was in medical school, there was a clinical helper. So this woman was basically hired to come in and let a lot of medical students look at her anatomy and do exams on her. And she did it because she wanted to make sure that we didn't leave like idiots thinking that everything was a vagina. And that's why her name is going to be Doris forever. But here we are going to learn what this Doris's parts are. So when we look at this, and this is, I know, a little cartoonish in what the parts look like, but we basically have what you can see on the outside if you were sitting sort of like crisscross applesauce with a mirror pointed down at your lady bits. And with that being said, this is not the vagina. There's so many different parts that are going on here that are important to recognize, label, and just identify with. So up here would be sort of where the hair grows if you were doing like a bikini wax, and this area that has a fat pad above it would be called the mons or the mons pubis. And that basically just kind of gives secretions and has some glands and skin-like texture that can change over time. You can, obviously have hair that grows there. You can get little infections and things like that. When you gain weight, you might see that it looks a little poofier, and then when you lose weight, it might get a little bit smaller. Everybody's can be shaped a little bit differently. But then when we're looking in that crisscross applesauce position, we start to see that hair goes down these sides here, and we get to the vulva, which is all of this, not the vagina. All right. So this thicker portion on each side is actually not just lips. This is the labia majora. So it is a thicker fat pad on each side of the vulva. It includes some shiny pink tissue as well as some hair. Kind of is like a little bit of a protective outside poofier area. All right. At the very top of the labia majora, you will see a clitoris. This is actually erectile tissue for a female that is completely full of nerves. It helps with lubrication, sexual function. It's very, very sensitive. It can actually increase secretions in the vagina so much that it can help with getting pregnant because it can help those secretions move sperm where you want it to go. On top of the clitoris is this little hood. We actually call it the clitoral hood. It's a little bit of a protective covering because that area is so sensitive that it truly does provide a little bit of barrier for the sensations that happen down there. All right, now, labia majora. These lips here, these are the ones that we think are all of our lips. These are actually the labia minora. And when we look at this tissue here, everybody's can look a little bit different. They could be rather flat to the area, or they could have length to them up to 10 to 12 centimeters for some women. They could have sort of a shorter end and a longer end, or they could be asymmetrical. It is completely normal. There's a lot of blood flow in this area. That means that if you did get an injury to it, it could kind of ooze and bleed a decent amount. Some people do choose to get cosmetic things done to it, but there is by no means a need for that unless there is some medical concern to this. Now, when we open up the labia, we got this now, right? We can see that there is usually some darker red or pink tissue that is involved in this area. Now, we have two holes that we see in this vulvar area. The rectum would be back here, totally separate, but when we look in this inside area, we're going to see two holes. All right, believe it or not, guys, you do not pee out of your vagina as a woman. They are two separate structures. So the first one that you'll see is the tiny hole. That is your urethra. That is the tube that connects you from the outside into your bladder, which is back this way. And it's usually about 4 centimeters long. It's shorter than men who have a 10 to 12 centimeter urethra. Because it is short, the proximity of it actually makes it much easier for women to get a bladder infection because the bacteria does not have that long of a distance to go. Below it, you're going to start to see sort of like ruffly tissue. And this whole area is called the vestibule, but this ruffly tissue outside the other hole, that would usually be sort of like the hymen. The hymen is just sort of the inner openings of the vagina. The hymen is this ribbony looking tissue on the outside. When we are younger women, it can be a little bit smaller, and then either with intercourse or tampon use, it can stretch, and sometimes women can have a little bit of spotting with their first tampon use or intercourse because of a small injury to the area. It heals very easily, but it can be a little oozy if injured. Beyond the hymen, you'll actually get the canal. And by canal, I just basically mean a bigger pipe. This bigger pipe where I am putting my hand right now, that's the vagina. You can't see inside of it. The inside of the vagina is actually the tube from the outside area that you can see to your internal organs, where we have cervix, uterus, ovaries, which we're not showing here. And that connects where your outside female reproductive organs connect with the area that can actually cause pregnancy and your period every single month. In these areas over here, there's multiple glands as well. Some of you may know them as the Bartholin's glands. There's one on each side. They can get big, swollen, infected, and cause abscesses. You have things called Skene's glands, which can actually get enlarged and infected. And then you can just get sort of like run-of-the-mill folliculitis, which is backed up hair follicles and collections if things get plugged up as well. The punchline is all us women have this. And you should have some familiarity with it, but the things that you see when sitting crisscross applesauce, it's your vulva. And all the bits that we just went over are the parts that make it up. The vagina is the deep canal that you can't see.